Essentially got a door anchor, right, which you can make yourself or they sell online, and then this would be a flat bicycle inner tube is what we most typically send home with patients in the clinic. Depending on how long it is, you're going to anchor it so that there's enough tension that when the patient gets set up in the traction apparatus, their head will hover just above the floor so they have some room to move. So for Max, we're going to put it here. And you want to make sure, of course, that you're pulling the door fully closed and preferably pulling it towards you. That's going to be a much more stable anchor. Okay, so then what Max is going to do is he's going to take these two sides of the strap, loop them right underneath the base of his head, and then it's going to come around the front of his ears, almost like you're tying a headscarf. So you want it in front of the ears. There you go, almost so that it's going to parallel your cheekbone. Okay? That's perfect. Now, if this isn't enough tension and his head hits the floor, what I would say is, hey, scooch away from the door a little bit. You can also have your patient scooch away from the door to impart as much traction as feels comfortable for them. So for example, if they are having nerve pain, you might say, and into their arm that is, you might say, okay, I want enough traction that it minimizes that, or you feel that it's reduced, okay? So once they're in the strap here, what you're gonna do is cue the same kind of chin tuck and then dorsal movement of the head or head movement towards the floor. Yeah, exactly. So if you can envision what's happening at their lower cervical spine in those C5, 6 areas, which tend to be here, and maybe that contributes to their symptoms, what's happening now is this, but also with some elongation of the traction with the rubber band here or the bicycle inner tube. They hold that for several seconds, longer if it feels good and if it's centralizing their symptoms, and then you can have them relax a little bit. Yeah, that's perfect. And try and tell them not to relax by letting their head go back, but to try and keep the chin a little bit approximated towards the chest. And when they're working, what they're really trying to do is push the head back towards the floor with that chin tuck. So when the relaxation occurs, it's really just letting the band win to lift them back off the floor. And when they're working, it's the chin tuck and then pushing back, just like that. So we really want to minimize the amount of lower cervical extension these patients are going into. Yep, and once more, Max, tuck and push your head back. Yeah, that's great.